Welcome back to my show, everybody. This is Sharon. Now, I know I've been missing in action for a while, but I'm back, and today we're going to talk about why I've been missing in action, and we're going to talk about some of the things that I've been through. So, I'm with my co host.
One and only Jamal.
TC can't be with us today, so me and Jamal, we have to pull the load today, so I hope we don't bore you or disappoint you with our show. So what the way it's going today, Jamal's gonna be asking me questions about where I've been and what's been going on with me, and I'm gonna answer the question. But I know I had to go do a rehab after I got out of the hospital, and this we basically gonna talk about the experience I had in rehab. Well, we're gonna talk about the hospital too, but we basically gonna focus on rehab. I was in a place called Heartland Skilled Nursing Center.
That's a physical rehab, not a drug rehab.
Yeah, physical rehab. I, I don't do drugs, so it's not a drug rehab. It's a physical rehab. And we're gonna talk about some of the experiences that I had in it. So I'm gonna turn it over to Jamal.
All right. So, what issues were you having that made you go to the hospital?
Well, turns out I had diverticulitis. I hope I pronounced that right. I was having trouble pronouncing that. But it was diverticulitis. I had to have emergency surgery. And I didn't want the surgery. I didn't want the surgery. I didn't want everything that went along with the surgery. But the doctor told me that if I didn't do the surgery, I had 7 days to live. So my family, for some reason, wanted me to live. So I went on and had the surgery.
Okay. What issues did you had it when you was in the hospital?
Well, I had they had to cut me open and take out part of my intestines, and because of that, I had this thing called a colostomy bag attached to me. They said it wouldn't be permanent and I can have it reversed, but I had trouble. Now some of the nurses that I had in the hospital, they were great. I was at Moses Cone Hospital in Greensboro, North Carolina. Some of the doctors I had, they were great. I mean, nurses. Some of the nurses I had were great, and some of the nurses was just pitiful. Just and some of the nurses they were just pitiful. But they had trouble finding the right kind of equipment for me, and it just kept failing over and over again.
Okay. So, how many weeks were you at the hospital?
While I was in the hospital for a month, for 1 whole month, I was in the hospital, and and then on top of that, I had to go on dialysis because I had my kidneys was wasn't the best, but this surgery pushed me over.
For the infection.
Yeah, the infection in my intestines just pushed me over, and it just destroyed my kidneys. What little kidney function I had, it just totally destroyed it, and I had to go on dialysis.
Okay. So, after you got out of the hospital, you had to go to the Heartland Physical Therapy.
I went to Heartland Skilled Nursing Center for rehab, and let me tell you, that was the worst experience of my life. I thought the hospital was bad because they used to the doctors used to want me to sit in the chair, and so I want to just lay down all the time, and which I ain't have a problem with that. I wanted to sit up because I was the bed wear you out, but they put you in the chair and they won't come back and get you and put you back in bed. You had to keep ringing and ringing and ringing until they finally come back and put you in bed. But then you had to ring and ring and ring so they can get you up and put you in the chair. So it was something else. But then I went after I was released from from Moses Cone. I went to Heartland Skilled Nursing Center. And let me tell you, I thought Moses Cone was bad. Woo! I long for the days when I can go back to Moses Cone because the place is okay for older people. You know, when people go and park their old people and get to come back and see them or don't want to be bothered with them, it's okay for older people, but they are not equipped for wound care. They are not. They the nurse is not trained for wound care. They don't know what to do. They only have one wound care nurse, one, and she got to take care of all the wounds that's in the facility. I don't know how many she had, but she was only one. Then they didn't have nobody when she went home. She worked Monday through Friday, and she would go home at 5 o'clock, and you were at the mercy of the untrained nurses.
Okay, so when you was there, what issues was you having with a nurse?
Well, they take forever to come. If you don't, the thing is now I had major surgery. And if you don't ring the bell, they will not come in your room and check on you. I could been laying in the room bleeding to death or dead. You think anybody cared? Sometimes they come in the room and will check your vital signs or or well, they had good med techs now. I have nothing to say about the med techs. They were fine. I'm not gonna call the name, so they probably don't want to be called out. But they had three good med techs, and I really, they were on it. They were on it, and um the physical therapists, they were on it. They were good, but as far as the nurses, they were untrained with wound care, and they said they were overworked, so that's why they didn't make their rounds the way they should. And you call them for assistance, and you sit for an hour, maybe 2 hours, before they even show up.
So when you was getting trying to get your bandage changed and all that, what was the issue that you was having?
Like I said, they only had one wound care nurse, and when she went home, she went home.
So
I mean, she was on call, but she was trying to tell them what to do, but they didn't know. They didn't know what they're doing, and they put on the wrong um thing, and it would either leak or fall off. And like I said, sometimes you ring that bell, and even the techs, the nurses, they won't show up for an hour or 2 hours. Then you sitting there in mess with nobody to help you.
okay, so when it finally came to help you, what kind of attitude did they have?
But some of them was okay, and some of them had some funky attitudes. And a lot. I confronted some of them. I confronted some of them. They say, "Nah, you don't know what you talking about. I ain't like that. Since you are like that." Then I got to the point where I turned them in to the nurses administrator. I'm to the administrator of the nursing home. But it didn't do any good because they were still rotten. Now there were three nurses that was great. I have nothing to say about these three nurses. And I let them know when I was there how I felt about them. But the other ones, uh-uh. Like I said, they are. I guess they are right if you just in there, your family put you in there because they didn't have time for you. I guess they were okay with people like that, but with people who really need a lot of attention because of their wounds, they suck big time. And I would recommend if you a patient that just had major surgery, if they want to send you to Heartland Nursing Skill Center, that you just go home because you're gonna get the same kind of attention at home that you got in there.
Well, you might get better attention at home.
Yeah, you get better attention at home because people, there to assist you. That is, if you have somebody at home to assist you.
So did they teach you how to change the
No,
bags, the wound?
no, they didn't teach you nothing. They didn't teach you nothing because they didn't have the right equipment, and they did not try to find the right equipment to help you. They just kept putting the inferior equipment on you when they know it's going to fail over and over again, but they just kept using the same thing. And it failed. And I got to the point where I refused to eat. I will not eat anymore. And because they didn't have the right kind of equipment. And they be like, you need to eat. I'm not eating anything until you find what I need to take care of my problem. So I basically starved myself while I was in there. I will only eat on the weekends. I will not eat during the week.
So why wouldn't you eat during the weekdays?
I had to go to the dialysis on Monday, Wednesdays, and Fridays, and I didn't want to be sitting around with this stuff falling off me. I knew it was gonna fall off of me. I wouldn't eat because I couldn't go over there and let the same thing happen to me there. Because if you go to dialysis and they smell something on you, they will tell you to leave.
That's all I said. Get up and leave.
They will not treat you. You gotta go. You gotta go. You gotta go.
Then you have to wait for your transportation
Then you
here.
have to wait for transportation. And when transportation come back, do you think they want you on the bus like that?
I guess not.
So to solve the problem, I will not eat.
Okay, and then after you talk to administrator, they get a little better, or
No, they didn't get any better after I talked to the administrator. I could tell she talked to them because they had attitudes, but they didn't get any better.
I hate to say, we hate to say it. Do your research on your physical therapy. See what the demographics are.
So, they, in my opinion, if it wasn't for physical therapy and for the bed techs and the three nurses that was really on it, I would give them a 1 star. But because they were okay, I give it a 2.5 star. But if they're trying to send you to Heartland Nursing Center in Greensboro, North Carolina for wound care, don't go because you're not going to get the wound care that you need. But not taking away from the wound care nurse that they have because she was good. So I guess that'd make 4 nurses being counting her. But she was good, but she's only one person, and she can only do so much. So now they talking about they moving to Colfax, North Carolina. They got to vacate the building they're in. But if you hear the name Heartland, I mean we had EMSs and other nurses. You said something about Heartland, they turn their nose up. They talking about how bad they are. So everybody I talk to knows about Heartland, and nobody has anything good to say about them, including me.
So pretty much, Heartland's pretty much the ghetto of healthcare.
Yeah, it's the bottom. It's at the bottom. It's at the bottom. It's not top notch. It's the bottom when you can't get nothing else. When your insurance won't pay for nothing else, they the ones you go to.
That sounds like hell. You was going through.
It's the next thing. It's just a notch above.
Not the boy here.
Yeah, notch above. You're almost there. You just didn't quite make it.
No, right. So like I said, anybody they go to Heartland Physical Therapy Center,
What do they call it? Nursing, a skilled nursing center.
skilled nursing center. You want to name the city they're in?
In Greensboro, North Carolina.
Stay far away from this place as possible.
Especially if you got wound care. If you need wound care, somebody take care of you after major surgery, that is not the place to go. Now, if you old and you can go there when you're old. But if you're there because you've had major surgery and you need help, nursing assistance and help, that is not the place to go because you're not going to get it. You might as well go home and do it yourself because they don't train you how to take care of yourself. They don't train you how to how to use the equipment. They don't train you with nothing. I was there 3 weeks and I learned absolutely nothing.
That's insane.
Yeah.
And then, like I said, when you ask for something, it seems like everybody got attitudes with you.
Well, the majority of them. Now, some
Mhm.
of them's okay. I won't say all of them. I will not say because they'll feel the younger nurses tech. The ones that hadn't been doing that so long. They're young and fresh, and they were on it. But you get the one that been doing that for a while, and they don't make that much money anyway. So they funky. But they had nursing students there. They there for their clinicals. They were good, but mm,
Well, like I said, people stay far away from this place as possible.
yeah, don't go there. If you hear the word Heartland, mm,
You know,
think about that twice, 3 times, 4 times.
uh,
Just just
I put your mic on the sorry, your mic about to down real quick.
oh my goodness, we don't want that to happen.
Oh, we don't.
Okay, so like I said, if you got it, if you're Heartland, don't go.
Hold on for a second. I think it did down. Let me turn it back on. You might have talking this.
Yeah, so that's my experience I had with them, and it was not good, and I don't recommend them. If you had major surgery, I don't recommend you going there because you're not going to get the help that you need, and that's sad, but you're not going to get the help that you need.
That's fair. Stay far away from that place as possible. Don't never go there. And if you know somebody is about to go there, make sure you tell them stay far away as they can. Anything else you like to add?
No, I think I've said enough. I don't think I have nothing else to say. I don't think I have anything else to say. I expressed my concerns, and that's all I have.
Until next time, people, make sure you like, share, comment, subscribe. Let us know what you think of Heartland Skilled Nursing Facility. Until next time, people, we out.